Every year, radiography, it's when radiography is being celebrated, there's a theme. So this year's theme is seeing the unseen. So which basically means that remember when you come to the hospital, when you're sick, the doctor needs to know what's happening with you. So in most instances, you'll be referred to our department, which is, we refer to it as medical imaging unit. So you come here, we do, depending on what you're here for, we do the x-rays if you need to be done the x-rays, which helps the doctor to be able to make diagnosis. Because having a doctor just to look at you while you're sick, not knowing what's happening inside, can be problematic. But with this technology that we use here in our department, we make sure that we see what's inside the body. Hence the theme for this year is seeing the unseen. The basic thing about this whole day is actually to celebrate the discovery of x-rays, of which this kind of discovery was an incidental discovery, like any other incidental findings within the medical fraternity, because one of the physicists from Germany by the name of Wilhelm Röntgen made this discovery of x-rays by accident, which was in 1895. So radiography, it's we can say in simple terms, it's actually an eye of medicine, because what you see with your naked eye, we see beyond that. So as diagnostic radiographers, we help the patient, and we also help the doctor to make a precise diagnosis for better diagnosis for the patient actually. All right, this is just example of how we manage the patient flow in our department. So the patient will be referred from any other departments, for example, casualties. So the patient will be having a form similar to this, which is a request form for x-rays. So the patient comes in, they start here at our reception. So they're gonna get to be assisted by one of our receptionists, for example, Mr. Maseko. So the patient hands over the form to our receptionist, whereby he will check on the system, check if the patient is valid, if the patient is still on the system, and if it's the correct patient. Then he'll print necessary stickers, and he will do the administration for that patient, opening a file for the patient, and even preparing the envelope for the x-rays. So from there, the patient will be taken to the waiting area, of which the patients will be sitting this side, waiting to be assisted. So as soon as the paperwork, the admin part is ready, then everything will be taken that side at the back, and will be taken by the receptionist, whereby the professional radiographer will be calling out the patients according to their series or when did they come this side. All right, so I'm going to take you to the x-raying room where we do the actual x-rays. So this is our workstation. So we'll have a professional radiographer here. He will be having information of the patient. Then he will enter the patient according to the requested studies. And then after doing that, then we go inside the room. Then he'll call the patient. Then the patient will come. And then he will explain the procedure to the patient and make sure as well that it's a correct patient. And then if the patient needs to change, we have a changing room where the patient will change into a medical gown, or hospital gown rather. And then the radiographer will adjust the machine according to how the patient needs to be x-rayed. Because we x-ray our patients while standing, for example, or obliques, or even when the patient is lying down. So this is just example of how we adjust the machine. It depends on with different lengths and different angles or degrees, depending on what we're doing on the patient.